drove all the way from West Coast of Florida to come today for you, especially for us. And Jenny had what I call natural facelift, NFL, natural facelift. Not the facelift that you may have heard of seen somewhere else. Now, do you agree with me that facelift could look very unnatural?
Yes.
Yes. And the unnatural appearance of a facelift usually is where the ear is being pulled down, the ear canal is like open, the scars are visible, and there's some hair loss, and people have to hide because of the facelift. Is that correct? I've heard this from many patients. This patient had something different. You see how natural a facelift? Doesn't look like a facelift. Now, may I? Okay, turn on a little bit. And here, do you see any scars here of facelift? No, you're not going to see anything. Nothing goes into the hairline, not this way, and not this way, and not down this way. And also, one of the things that can happen with a facelift, when you start doing a facelift, that the ear can drop down, and the ear canal is open. Where if you look, this is her left side, and if you look at the left side, look at this. Actually, the ear is a little higher than when we started with, and the volume is a little bit fuller of the face. So, why do we do this? Why do we lift the ear and get more volume? Because in a regular facelift, they do the opposite. The ear goes down. You know how you have earring even? The earring causes the ear to go down, the earlobe. So imagine in the operating room table, you do the entire procedure and you hook it to the ear. It's like a big earring the rest of your life, and it goes down. So at the beginning of the case, we raise the ear ever so slightly with a suture technique, something that we developed here. And then we use the volume, the fat, to build up the midface. So now if the midface is a little bit fuller, you have two things: more volume, and the ear is higher. Therefore, when the skin is elevated, muscles are tightened, there's less skin that needs to be removed. If there's less skin that needs to be removed, shorter incision, then you can hide the incision. So you can hide it inside the ear. And that's the whole idea. How long ago was it?
December 16th. This is my present to myself.
You want pass? What do friends say when they see you now?
They, you know, because I used to live on this coast and I moved to the West Coast, so some people haven't seen me for about a year to year and a half. And whenever everybody sees me now, they'll say, "You look so good." And it's like, what did you do that 2 years later, I haven't seen you for 2 years and you're looking younger than ever? So maybe they think it's the water over in Clearwater. But it was really such an easy process, and you know, I fretted about having it done for so long, and it got really to the point that when I looked in the mirror in the mornings, I just couldn't stand to look at myself anymore. The wrinkles, and my mother aged prematurely, so I could just see my mom every time I looked in the mirror. And we were talking about this earlier. It's almost, you know, it's really better than getting psychotherapy.
Yeah.
It really is.
Really
it does.
is.
There is an emotional and mental enlightening with it. It's a very interesting way that happens. But you know, you feel as young as you look. You really do. So thank you.
Thank you very much.
That's great.